Radiation oncology is a form of radiation treatment for cancer patients, and there's three basic ways to fight cancer. One is to cut it out by the surgeon. Another is medical oncology. Doctors will give chemotherapy. And then the third arm, which is used in more than half of all cancer patients, is to use X-rays, radiation treatments, over either one day or several weeks to treat tumors at any location in the body. So we are a part of the oncology team. The radiation oncologists work with both surgeons and chemotherapy doctors to develop a radiation plan and an overall plan for the best of the patient.
And I noticed that you all have something called True Beam. I'm assuming that that's a brand name of some new technology, correct?
A True Beam is a state-of-the-art radiation machine from a company called Varian Oncology. Varian is the world leader in producing radiation equipment, and we actually will have two of these machines in our new cancer center in Canal City. These machines are, bar none, the best machines on the planet. They are amazing, and I am excited personally to be able to use them. We've always offered state-of-the-art treatments, but this will allow us to treat patients even more precisely. We're talking less than a millimeter accuracy, sub-millimeter accuracy, in very short treatment times, with the ability to see the tumor in real time, to track the patient on the table. So any radiation service that is required will be available in our community, and it's an exciting time to be a physician. The patients are going through one of the worst experiences of their life, most likely, and so we have a wonderful staff of folks that can provide all the emotional needs and support and informational needs, but to be able to offer them the world's best radiation treatments and to have the ability at our fingertips is really a wonderful thing, and I'm excited about it.
This, and I understand that this too should lessen the impact of the radiation treatment and possibly speed up the process and make it a little less painless. Is that correct?
Yeah, radiation is an outpatient procedure. It can be used for inpatients, but most of our patients either drive, they can drive themselves oftentimes, or have a family member come with them, and it's treatment is given usually 5 days a week in a 15-minute time slot. They lay on the table for 10 or 15 minutes. Some patients even take a little nap or listen to music. It does not hurt. You don't feel it. It's in a nice open room. In fact, the facility is just absolutely beautiful. There's local artwork from West Virginia. It's a very soothing type environment. But the treatment itself is a 15-minute treatment in most cases, and the True Beam will allow us to actually to do what's called rapid arc and radiosurgery and some other things that can even deliver a 15 or 20-minute treatment in 90 seconds, I'm told. So the patient comes in, they lay on the table, we attend to their needs, and within 10 or 15 minutes they're out the door and go on with their day. It doesn't hurt. There's no blood. It's pretty amazing.
What type of cancers can you treat with this?
You name it. We treat head to toe, adults and pediatric cases. The big three are breast cancer, lung cancer, and prostate cancer. But we treat everything: GYN cases, brain cases, skin cancers. If you have a cancer, we are able to take care of it if it's appropriate, if it's if it's in the right place, in the right size, it's the right kind of cancer. These are all things that we would discuss before treatment. There's a planning process that might take a few days, but generally within just a few days we can start a treatment, and we help many people. About half of our patients are curative, and about half of the patients are palliative, where we make them comfortable. So whether we're going to try to hit a home run and cure the cancer, or whether we're just trying to take away pain or make people's quality of life better, these are the things that we discuss and we help people with. And
I think this is the only one of its kind in West Virginia, isn't it?
I'm not sure. I know that they're. It's the best machine on the planet, and we have two of them, and we got all the bells and whistles. So we can track things to within a millimeter, and I'm not sure how many there are around. I know there's not many, but we're excited.
Yeah, and that's in the new CAMC Cancer Center that just opened in Canal City, part of Charleston, and I guess this will be going online, October 5th?
Yeah, our start, we're doing a slow start, so we're going to phase out our current facility in Canal City, and we're moving across the street to where Powell Park used to be. And actually, you can see where home plate used to be there in the parking lot. They've kind of emblazoned it in bronze, and that's kind of, when I was in high school, actually, I stood at that home plate, and it's kind of nostalgic. But yeah, the cancer center will be where old Powell Park used to be. CMC offers, our department's name is CMC Radiation Oncology Services, and it's a joint venture between Alliance Oncology, which is a division of Alliance Healthcare Services, CAMC, and Charleston Radiation Therapy. And so we're going to move in there. In just a few weeks, we'll be treating our first patient.